Good day, ma'am. I am LCP Hilo from the SN1C. So today, I'm going to do the specimen collection. So specimen collection is a sample of material taken from the patient's body to use in diagnostic and laboratory examination. So specimen collection means collecting a specimen. So types of specimen collection is clean catch, midstream urine collection. Number 2 is 24-hour urine specimen collection. Next is the urine specimen collection from an infant. Next is catheterized urine specimen collection. And next is stool specimen collection, sputum specimen collection, and the last one is throat swab culture. Special consideration. The procedure of specimen collection may vary depending on the type of examination. An appropriate container must be clearly labeled, tightly sealed, and sent promptly to the laboratory. Proper precaution must be taken to prevent loss, spillage, and contamination of the collected specimen. Instructions to the patient must be clear to ensure proper collection of specimen and to help allay anxiety. Laboratory requests must be completely and accurately filled out. Nurses' rule in specimen collection. First is patient interaction. Next is suitable selection of supplies. Next is appropriate and proper collection and precise sample identification. And the last one is up-to-date transfer to the lab. So the first type of specimen collection is the midstream clean catch urine collection. Now let's define it. Midstream clean catch urine collection is the most common method of obtaining urine specimens from adults, particularly men. This method allows a specimen which is not contaminated from external sources to be obtained without catheterization. It is important to follow the clean catch protocol in order to have accurate results from an uncontaminated sample. So the purpose of this is that the clean catch urine method is used to prevent germs from the penis or vagina from getting into urine sample. It is method of collecting a urine sample for various tests, including urinalysis, cytology, and urine culture. This is valuable for confirming alterations in metabolism, infections, and fluid volume problems to determine appropriate antibiotic to administer to a specific patient. So the materials or equipment we use is that container with warm water, soap, washcloth, antiseptic swab or cotton balls, sterile specimen container, label for the container, bedpan, and non-sterile gloves. Check doctor's order, assess a client's ability to follow instruction, determine any special needs of the client, determine what urine test is requested, determine and obtain what articles are needed to obtain a non-contaminated urine specimen for culture and sensitivity or C&S. Identify client, check to see if permission is required. Explain the procedure to the client. Provide for privacy. Wear clean gloves. Position client and place bedpan. Wash perineal area with proper technique. Ask client to begin voiding. When stream of urine begins, put specimen container and obtain 30 ml of urine for routine analysis or 5 to 10 ml for culture and sensitivity or C&S. Remove container before client stop voiding. Allow client to complete voiding, then wash perennial area. Specimen completely and accurately. Clean bedpan, use and discard gloves. Wash hands and send specimen with appropriate laboratory request. For evaluation, evaluate physical response of client, evaluate specimen and laboratory requisition if filled out completely, and evaluate urine specimen. For documentation is record amount, color, odor, collection time, signs and symptoms of urinary infection, record time when the specimen was sent to laboratory and what test was requested. The second type of specimen collection is the 24-hour urine specimen collection. So, a 24-hour urine collection is performed by collecting a person's urine in a special container over a 24-hour period. It always begins with an empty bladder so that the urine collected is not left over from previous hours. The specimen shows the total amounts of waste the kidneys are eliminating and the amount of each. The purpose of this is that a 24-hour urine collection is non-invasive. The skin is not pierced. It is used to assess kidney or renal function and detects diseases. And it also to provide means to measure the concentration and dilution of urine. The materials or equipment we use is urine specimen container enough to collect 1.5 liter, refrigerator, label for specimen, sign the urine collection is in progress. Check doctor's order, assess client's ability to follow instruction, determine any special needs of the client, determine what urine test is requested, determine and obtain what articles are needed, maintain the collection of urine for 24 hours. Identify client and explain the purpose of procedure. Give instructions to client's watcher if around. Place sign in client's bathroom stating that 24-hour urine collection is in progress with date and time. Discard first voided specimen. Collect all urine specimens thereafter until same time the following day. Store it in refrigerator or at room temperature. After the last voided specimen is placed in the container, cover and send entire specimen to the laboratory promptly following the agency protocol. Wash hands, remove sign and remind client that the test is completed. If the specimen is accidentally discarded, obtain a new container, note the new date and time and restart the procedure. For evaluation, evaluate physical response to client, evaluate specimen and laboratory requisition if filled out completely. For documentation, record method used to obtain specimen, record amount, color, and odor of specimen, record date and exact time for 24-hour urine collection, and the last one is record time specimen was sent to the lab and received by the lab technician. The third type of specimen collection is the urine specimen collection from an infant. It is the pediatric urine specimen is collected from infants who are incapable of telling the time of urination and following direction for collection by themselves. The purpose of this is that to collect pediatric specimen accurately. The materials or equipment we use is cleansing swab or cotton balls, towel, pediatric urine collector, and diaper. Check doctor's order, assess client's ability to follow instruction, determine what urine test is requested, determine and obtain what articles are needed. Identify the client, explain the procedure to client's mother. Cleanse and dry child's perineum. Apply urine collector to the child by placing child penis through the opening collector if it is male, placing the opening of the collection bag over the child's urinary meatus, avoiding extension over anus. Place a clean diaper on the child. Wash your hands. Check the collector every 15 to 20 minutes. Remove collector if already filled with urine and place a clean diaper on the child. Pour urine into the specimen container and send it to the laboratory. Wash hands. For evaluation, evaluate urine specimen obtained, evaluate laboratory requisition, if filled out completely. For documentation, record method used to obtain specimen, record amount, color, and odor of specimen, record condition of perineum, and record time specimen was sent to the lab and received by the lab technician. The fourth type of specimen collection is the catheterized urine specimen collection. It is collection of urine specimen from the urinary catheter. The purpose of this is to obtain sterile urine specimen for microbiological analysis. The materials or equipment we use is sterile 10 ml syringe with 23 or 25 gauge needle, non-sterile glove, alcohol swab, sterile specimen container, container label, and catheter clamp. Check doctor's order. Identify the purpose of the urine test. Identify the type of collecting tubing attached to the. Identify the patient. Explain the purpose of the procedure and provide privacy. Clamp about 4 inches below junction of drainage tubing and catheter. Leave it clamped. Wear gloves. Cleanse specimen collection port of drainage tubing with alcohol swab. If no collection port is visible, cleanse catheter tubing. Slowly, squirt urine into the specimen container without touching inside of container. Send specimen to laboratory promptly with proper label and proper requisition form. Discard gloves and wash hands. For evaluation, evaluate appearance of urine in the bag and specimen obtained. Evaluate condition of urinary catheter. For documentation, you record procedure and flow sheet, or record method used to obtain specimen, record appearance of urine, and record time specimen was sent to the lab and received by the lab technician. The fifth type of specimen collection is the stool specimen collection. So let's define this. Stool is a waste material eliminated from the bowel. A stool culture is the process of growing or culturing organisms existing in feces to see if any of them cause disease. The most common is the ova and parasite test, a microscopic examination of feces for detecting parasites such as amoebas or worms. Stool specimen is often tested for blood. Guaic or hemiocult tests may be done in the laboratory but are sometimes done at the nursing station to test a stool for occult blood. Purpose: to determine the elimination status of the client. Next is to identify GIT dysfunction. Type of stool examination. First one is routine fecalysis. Stool exam used to assess gross appearance of stool and presence of ova or parasites. The second is stool culture and sensitivity test. Stool exam used to assess the specific etiologic agent causing gastroenteritis and bacterial sensitivity to various antibiotics. The last one is the Guaic stool examination. It is a microscopic study of stool for presence of bleeding in the GIT or occult blood. So the blood or the stool Guaic test finds hidden occult blood in the stool bowel movement. It is the most common form of fecal occult blood test or GFOBT in use today. So the materials or equipment we use is wide mouth bottle or disposable wax box, tongue depressor, clean bedpan or bedside commode, tissue paper, washcloth, soap and water, sterile test tube and sterile cotton applicator for stool and CS, container label, and clean gloves. Determine the purpose of the test. Determine the eliminatory status of the client. Assess gastrointestinal tract or GIT dysfunction. Assess client's ability to follow instruction. Check physician's order. Determine special needs of the client. Determine what stool exam is needed. Determine and obtain articles needed. Identify the client and explain the purpose of procedure. Wear gloves. If the client is able to go to the bathroom, give him or her needed instruction. Provide privacy and place clients in mid or high Fowler's position. Place bedpan. Ask client to void first clean out urine from bedpan. Clean bedpan, remove gloves, and wash hand. Send the specimen to laboratory immediately. For evaluation, evaluate physical response of client, evaluate specimen and laboratory requisition if filled out completely. For documentation, record the following: time the specimen was collected and sent to laboratory, description of the stool, and condition of the perineal skin. Sixth type of specimen collection is the sputum specimen collection. So this sputum is a deep cough phlegm collected for laboratory analysis. A sputum specimen is a sample of material expelled from the respiratory passages taken for laboratory analysis to determine the presence of pathogens. Specimens are often taken for 3 consecutive days because it is difficult for the patient to cough up enough sputum at one time, and an organism may be missed if only one culture is done. The purpose of this is that a sputum specimen is obtained for culture 2, identify the microorganisms responsible for lung infections, identify cancer cells shed by lung tumors, and aid in the diagnosis and management of occupational lung disease. Type of sputum examination is: first one is sputum culture and sensitivity test. Sputum examination assesses the specific etiologic agent of respiratory tract infection and bacterial sensitivity to various antibiotics. The second one is the acid-fast bacilli or AFB staining. Collection of sputum specimen for 3 consecutive mornings to assess presence of active pulmonary tuberculosis. And the last one is the cytologic or Pumpernicula sputum examination. It assesses for presence of abnormal cancer cells. Special consideration is early morning sputum specimen must be collected. Collect sputum specimen of C and S before the first dose of antimicrobialysis is given to client. Use face mask as protective device if client is suspected PTB case. The last one is note client's tolerance to procedure. The materials or equipment we use is sterile sputum specimen container with cover, label for specimen, emesis basin, tissue paper, small plastic bag for delivery of specimen to laboratory, glass of water, and face mask. Check the physician's order, note client diagnosis and tolerance to the procedure, assess client's ability to follow instructions. Determine any special needs of the client, determine what type of sputum examination is required, determine and obtain article needed. Identify the client and explain the procedure. Wear face mask as protective device. Provide privacy and assist client to a sitting position if not contradicted. Instruct client to rinse mouth with plain water and ask to deep breathing before collection of specimen. Ask the client to cough deeply in order to hack up lung secretion into sputum container. Cover container, label accurately and place in a small plastic bag. Wash hands and remove mask. Send specimen promptly to the laboratory. For evaluation, evaluate client's respiratory status if maintained during and after the procedure, and evaluate the specimen collected. For documentation, record the following: the time the specimen was collected and sent to laboratory, description of sputum and respiratory status of the client. The last type of specimen collection is the throat swab culture. A throat swab culture is a laboratory test that is done to identify germs that may cause infection in the throat. It is most often used to diagnose strep throat. The purpose of this test is done when the throat infection is suspected, particularly strep throat. A throat culture can also help the health provider determine which antibiotic will work best for the patient. The special consideration is collect sputum specimen of and CNS before the first dose of antimicrobials is given to client. The second is use face mask as protective device if client is suspected to PTB case, and note client's tolerance to procedure. The materials or equipment that we use is for bacteria, culture swab or equivalent collection system. All others, virus, chlamydia, mycoplasma, collection pack. Label for specimen, Mrs. Basin, tissue paper, small plastic bag for delivery of specimen to laboratory, glass of water, and face mask. Check the physician's order, note client's diagnosis and tolerance to the procedure, assess client's ability to follow instructions. Determine any special needs of the client, determine what type of sputum examination is required, and determine and obtain article needed. Provide privacy and assist client to a sitting position if not contraindicated. Put on gloves, surgical mask, and protective eyewear. Have the patient to face a strong light to ensure the area to be
Have the
swabbed is
patient
visible. Tilt their head backwards, open their mouth, and stick out their tongue. Have the patient tilt their head backwards, open their mouth, and stick out their tongue. Use a wooden tongue depressor to hold the tongue in place. Without touching the side of the mouth, use the sterile flap swab to swab the posterior nasopharynx and the posterior arches. Insert swab into sterile liquid amys transport system vial. Break the swab handle and scored breakpoint line. Replace cap and tighten to secure. Remove and aseptically dispose of gloves and mask. Label liquid amys vial with appropriate information. Send specimen promptly to the laboratory. For evaluation, evaluate client's respiratory status if maintained during and after the procedure. Evaluate the specimen collected. And for documentation, record the following: the time the specimen was collected and sent to laboratory, and the respiratory status of the client.